I know you do a lot of interview coaching because of your experience of interviewing residents and fellows as of right now.
Yep.
What are the most common flaws that you harpen on or work on to
Yeah,
polish these applicants that you're working with?
absolutely. So um, the few things that I wish the applicants would pay a little bit more attention to. The first thing I would say is, I would really like the practice to kind of work with these applicants about 2 to 3 weeks before the actual interview. I'm not saying 6 months or a year, but it shouldn't be like, 2 days before the interview, I'm doing a practice interview, because then it's very, very difficult to um, refine your answers. So one is the timing of the interview. Then, some of the questions, and these are like common questions, like, can you tell me an interesting case that you saw? And, if the applicant is not able to come up with an answer for that, then that just shows how unprepared he or she is. So certainly they should be very, I would really like them to at least, think through the common questions that, there are a lot of websites and a lot of stuff, even my blogs, where we talk about common questions. And then things like, if I, as the interviewer, am asking the applicant, do you have any questions for me? Again, I don't think it's, there has to be at least one question, maybe even if you've asked someone else, you should really have a question. And there, then there are some challenging questions, like, tell me your strengths and weaknesses, that kind of a thing. The weakness is a part where, people sometimes are not able to like clearly say, and that's where I help them out with. And then there are some questions like, why should we take you into our program? Kind of very traditional
That's a
questions.
big one, I
That's a
think.
big one, yeah. And it kind of is, they kind of like to ask that in the end, just to kind of like summarize everything. Lately, from what I'm reading, there has been a lot of interest in asking behavioral questions, because, that's what, because I think program directors know that, everyone's going to be prepared to answer the very common questions, like, tell me about yourself, or what do you want to do after residency. But then, putting that applicant in specific situation scenarios and see how they would respond in those scenarios is, I think, what the program directors are looking for.
To clarify to our listeners, when you
Yeah.
say behavioral questions, can you give me an example so they know what we're dealing with?
Absolutely. So, these are questions, sometimes we hear about, okay, you're on call and you have your colleague, your co-resident, and you smell alcohol in that person's breath. Or things like, you made a mistake like, for example, you're doing a procedure, you're putting a line in and you kind of made a mistake. So what do you do in that scenario? How do you, what do you tell the patient? What do you tell the family? What do you tell your attending? Those kind of scenarios are, something that the applicants are, I think, are going to be increasingly asked about. Yeah.